Hi everyone, my name is Carly Wallace and I'm a nursing student at Concordia University, Texas. My presentation today will be targeting the veteran population regarding vaccinations. To begin this presentation, I'd like to present a couple of questions to you to keep in mind throughout the presentation. It's sort of a pre-presentation quiz, however, it's okay if you don't know the answer to these or if you don't really have an idea. It's just good questions to keep in mind throughout this presentation. So I'm going to put them up on the screen right now. We're going to talk through some of these questions and then we're going to dive into the presentation. So this pre-quiz is essentially going to test your knowledge before the presentation begins. Now, it's no big deal if you don't know the answer to these questions, but it is good to check in with yourself to see what do I know and what do I not know. After we've had some time to kind of talk through those pre-presentation questions, I'd like to give an overview that briefly summarizes what this presentation will be about. I'm very passionate about the veteran population as well as vaccinations. I think that it's very important to get good information that's reliable, it's based on science, and it is based on evidence throughout the scientific community. And I think that it's extremely important to answer these questions like, what are vaccinations? How do they work? Why should I get vaccinated? Am I too old to be vaccinated if I hadn't been started as a child? Where do I go as a veteran to get access to these vaccinations? Am I even able to access vaccinations? These are all questions that I'm aiming to address in this presentation, and I hope that it will shed some light on this topic and it will give you enough information to make these sound decisions whether or not you will choose to be vaccinated or not. And so my sole goal today is just to arm you with some good knowledge, give you some reputable and very trustworthy places to go to get information if you'd like more information. And I think that overall I'm excited to cover this topic with all of you today. All right, and we can see the full poster board here, and we're going to start in the middle, on the top right in the middle, and we're going to talk about how do vaccinations work. So as you can see here, I've provided a diagram, and this basically shows how a vaccine works in your body. So to begin, you're given a small amount of a harmless form of a disease. So for example, a flu vaccine, because that's very, very common. You get it yearly. You're given a little dose of that flu. It's a harmless amount, but you're given that through an intramuscular injection. Typically, you get it in the arm, in your muscle of your arm. Then your body makes antibodies to fight it off. So once that disease is introduced into your body reacts and creates antibodies in order to fight this off. Then if you encounter the disease again, your body already has the antibodies, and so you don't get sick. Therefore, you are immune. This is a very simplified way to kind of give you an idea and a picture of how a vaccination works in your body. I've included another diagram here, and this basically just illustrates what antigens will do and what antibodies will do, and the reason why antibodies are so very important. So typically when a new pathogen or disease enters our body, it introduces a new antigen, and so the antigens are illustrated here as the flu, the measles, chickenpox, or a new pathogen. So our body needs to create or build specific antibodies so that those antibodies can grab on to the antigens and fight them. And that's essentially how our immune system works. There are other ways besides vaccinations to create antibodies, typically exposure to the flu, the measles, chickenpox, etc. However, the vaccine allows us to be introduced to these antigens without getting the full effect of being sick, like getting the flu, full-fledged flu. It's a better alternative than being exposed and having to deal with being sick. Another question that I'd like to tackle is, why should we get vaccinated? So according to the National Foundation for Infectious Diseases, there are 10 main reasons why we should all be vaccinated. And the first is vaccine preventable diseases have not gone away. Number 2, vaccines will help keep you healthy. Number 3, vaccines are as important to your overall health as diet and exercise. Number 4, vaccination can mean the difference between life and death. Number 5, vaccines are safe. Number 6, vaccines will not cause the diseases they are designed to prevent. Number 7, young and healthy people can get very sick too. Number 8, vaccine preventable diseases are expensive. Number 9, when you get sick, your children, grandchildren, and parents may be at risk too. And number 10, your family and coworkers need you. The bottom line here is that no one has time to be sick, right? We all live very busy and very jam-packed lives. And so oftentimes these illnesses that could be prevented with vaccinations are detrimental to our mental health, our spiritual health, our financial situations can be absolutely crushed because we're sick and cannot show up to work. And so these things are all important to take into consideration when you're thinking of why should I get vaccinated. Another reason that didn't make it on this list, but I found via the CDC website, is that we should not only choose to be vaccinated for ourselves, but we should also do it for those who cannot be vaccinated, who are immunocompromised. By being vaccinated, we are protecting those people as well. And so these are just some of the reasons that you should keep in mind when thinking, why should I get vaccinated? There's lots of circulating information going around that is not very credible, and so certain things that have not been backed by science have been endorsed by the population as a whole. And so I think it's very important to kind of bring some fact checking into this presentation. I won't read every single one on this paper. Feel free to read every one, but I wanted to hit the high point of, and it's number 1. The myth is the effectiveness of vaccines have never been proven. And the fact is that there's widespread use of vaccines has nearly wiped out diseases like smallpox, measles, and polio since the mid-1900s. And so I'll definitely leave some time for you to read a little bit more about this fact-checking section. But again, it goes back to it's very important to look at where you are getting your information from and check your sources. You know, anybody can post anything on the internet these days, and so it's very important that you look and see, am I getting my information from a credible site? Because you don't want to be misled by taking what you read on the internet and not taking into consideration who wrote it, what credentials do they have, and are they based on fact or fiction? Are vaccines safe? This is a big question and is really at the center of every conversation regarding vaccinations. So I'd like to address this question with some information that I found on the CDC website. Vaccinations are tested and monitored. They go through years of testing before the Food and Drug Administration, or FDA, licenses them for use. Both the CDC and FDA continue to track the safety of all licensed vaccines. Vaccine side effects are usually mild and they go away in a few days. The most common side effects include soreness, redness, or swelling at the site of injection. And then severe side effects are very rare. They do happen. We're not saying that they never happen. They do happen, but they are rare. Vaccines are one of the safest ways to protect your health. And the biggest takeaway from this presentation that I would love for you to know is that you really need to talk to your doctor about vaccines you should safely receive based on your health and other conditions. Everyone's situation is different, and it's just best practice to always consult with your primary healthcare provider and see what their recommendations are for you regarding vaccinations. I've included a handout here, and it is from the Immunization Action Coalition, and you can find it online at immunize.org. And this chart essentially gives a breakdown of the different vaccines that are available and whether you need it or not. Now, I always say that you need to consult with your primary healthcare provider before deciding what you need and what you don't need. However, this is here for your reference to kind of give you an overview of the kinds of vaccines that you could potentially need. And I provided this because I'm come with the full understanding that veterans come from all different kinds of walks of life. They have so many different backgrounds, so many different stories. So some veterans may not have been started on vaccinations when they were young. And so I'm bringing this message here today that you are never too old to get vaccinated. Vaccinations, it's a total lifelong process. It's lifelong protection for yourself. It's something that needs to be kept up on. And so it really is a journey. And it's not something that, well, if you missed the train when you were younger, then that's just it. No, you're never too old to get vaccinated. The one thing that I will say is just, again, before you make any decisions like that, do consult with your primary healthcare provider to see if there are any contraindications for why you should be getting these vaccinations. But I included this in the presentation. There's a link for you to take with you. And I just think it's great information, and it really helps, especially if you're someone who was not started on different series of vaccinations when you were younger. So now that I've given you a ton of information, the next question might be, well, what do I do with all this information, right? I've made the decision that I would like to get in contact with some people about vaccinations, so now what do I do? Well, first and foremost, veterans, I'm speaking directly to you. There are a couple of websites that you can go to on a national level that can help you get to a more local level to find the resources that work for you. The first website is www.va.gov. That's going to have all of your updated information regarding veteran status, vaccinations, and that can take you on a national level to see what's going on nationally with veteran affairs, and then it also there's some avenues that you can take where you can get local information as well. MakeTheConnection.net is another wonderful resource. They will help you get in contact with your local VA and find ways to get you the care that you need regarding healthcare, not just vaccinations, all kinds of aspects of healthcare. The National Veterans Foundation created Lifeline for Vets, and they cover all different kinds of issues that you might be running into, such as addiction, mental health issues. If there's suicidal issues, there's a hotline for that number. But they do specialize in getting you hooked up with the right healthcare so that you may have access, the access that you deserve to getting those vaccinations and getting quality care. So again, that's Lifeline for Vets, and that is on a national level. You can go on their website, put in your information for where you live, and then it will narrow it down to more local groups that are close to you to get in contact with. Now, there are some resources for everybody to know that's good to get good, reliable information from. And so the CDC.gov is one website that is always top-notch with their information. They're very accurate, they stay current and up to date, and the CDC is really the mothership of all websites as far as health is concerned on a national level. VA.gov has information that they put out regularly that I would encourage you as a veteran to stay up on the VA.gov website. The WHO.int is World Health Organization, and they also come out with regular health information and newsletters and things, and so I encourage you to stay current as far as everything medical. If you're concerned about vaccinations, if you're concerned about anything from COPD to heart disease to hypertension, there's all different kinds of information, and these three websites are very, very good at keeping the facts straight based on scientific based evidence, and they're great resources to turn to when you have questions. To wrap up this presentation, I've provided a post-lecture survey, and I'd be really grateful if you would fill that out. There's also a link that I've shared as well as it being up on this presentation. If you're a veteran, thank you so much for your service. I appreciate it more than you know, and thank you for taking the time to listen to my presentation.